Nice to see everybody today on a relatively sunny spring day. As Bill said, I'm Paul Jocelyn, Executive Director of Access CNY. I have two colleagues with me here today. Eric Boy, who is our Associate Director of Mental Health Housing, and also Russ Gentili, who's our Associate Director of Mental Health Community-Based Services. All organizations need strong leadership in times of crises, and Eric and Russ were exactly that for Access CNY. They did an amazing job of making sure that people we support in our mental health programs continued to receive the support they needed throughout the pandemic. So I'm gonna turn it over to them in just a minute so you can hear directly from them about their experience and a little bit more about our mental health services. But I just wanted to start with a quick overview of Access CNY and what we're all about. So Access CNY is a relatively new organization, but also one with a long history of providing supports to people with either a mental health diagnosis or a developmental disability. We were born out of a merger of two other organizations, Enable and Transitional Living Services, merged in January of 2015 to create Access CNY. And we've continued to grow through adding new programs that meet the needs of our community, as well as through mergers and collaborations with other organizations, especially smaller organizations that might need the administrative support that a larger organization has to offer. And so we've gone through a few additional mergers in the last few years. We've brought Spalding Support Services on board as part of Access CNY. They were a small organization that provided services to people with developmental disabilities. We also added Onondaga Casa as a program a couple years ago. That is a wonderful program that helps children who are victims of abuse and neglect, and also part of the foster care system. And then lastly, we formed an affiliation with L'Arche Syracuse, which is a faith-based organization that serves people with developmental disabilities. So as we sit today, we are an organization that supports over 3,000 people, about 3,300 people with a developmental disability, mental health issue, or a physical disability. And we do that through offering about 30 programs, and we employ about 1,400 people to operate those programs. So we're certainly on the larger side of organizations in Central New York when it comes to human services anyway. And we have 5 main program areas. I'll talk about the first 4 and then let Russ and Eric talk about the last. So we have a clinic here at our Court Street building on the north side of Syracuse that provides speech therapy, occupational therapy, and physical therapy to people both with and without a disability. So we have a lot of people who use wheelchairs temporarily or permanently and want to maintain flexibility and strength, and we help them with that. And we serve quite a few people who have had a tragedy in their life, a car accident, a stroke, that type of thing, and need some therapy to recover from that. Also at our Court Street building, we have an integrated preschool that serves children both with and without disabilities. And we operate our consumer-directed program that helps people who would otherwise be living in a nursing home remain home by hiring their own staff to help them with daily living skills. Things like doing the dishes, helping them clean their house or apartment, those types of skills. And so that's a very important program for us. We serve over 500 people in that program. And then our 4th program area is probably our biggest, which is an array of programs that support people with developmental disabilities. We have everything from housing supports that provides 24/7 staffing. We also have a variety of programs that help people live as independently as they wish in the community through an employment program that helps people find jobs. We have programs like rehabilitation and community habilitation that helps people learn skills that they need to live independently. And then there are a few other programs. One of my favorite to talk about is our David Clark Learning Center, which is a day program for people with an acquired brain injury. And that program helps people explore their capacity for learning after a brain injury through things like art and music and writing. And so that's just a wonderful place to visit in a terrific program. And as I said, our 5th and last program area is our mental health programs. And at this point, I'm going to turn it over to Eric and Russ so you can hear directly from them about those programs and our experience with COVID in those programs.
Sounds good. Thanks, Paul. Yeah, so as Paul was saying and describing, Russ and I are the directors for Access CNY's mental health programs and services, which we offer to people who are living in Onondaga County. Just a quick overview as far as the prevalence and the level of need for mental health services in New York State. According to New York State's Office of Mental Health, in 2020, 18% of adult New Yorkers, which is about 2.7 million people, experienced mental health concerns in the past year. 3.7% of New Yorkers, which is about 570,000, are living with what New York State deems to be a serious mental illness. So this is an ongoing issue for a whole lot of of the people who live in our community with us, and so that's why our programs are here to try and assist them. New York State offers 44,000 residential beds for people who are living in mental health housing programs, and 700 of those are in Onondaga County. There's over 2,400 different community-based programs which provide services to people in the state, so I take care of the housing portion, and Russ works with people who are looking for community-based supports. Access CNY Mental Health Services, we served about 700 people in the last year, with about 200 of those coming through my programs in the mental health housing services, and another 650 of those being served in the community by Russ's programs. The housing programs, we have 185 available beds for people who are looking for support in learning how to live on their own in the community. The people that we work with come to us from a variety of places, including hospitals, outpatient facilities, therapists, psychiatrists, caseworkers, other programs that are similar to ours in the community. And we can offer different levels of care, ranging from people who are living in a group home format with maybe 8 different roommates, 8 different people living in the same house together, to being in an apartment with 1 roommate, to having their own apartment in the community. And our overall goal is to help somebody to progress from what could potentially be a mental health crisis, which requires inpatient treatment, and helping them with learning how to live on their own successfully, managing day-to-day needs, taking care of things like medications, doctor's appointments, taking care of an apartment, developing relationships, and developing their own support network, so that they can eventually move into their own apartment where they're the tenant of record and responsible for maintaining their own space. So my housing programs at Access CNY work very closely with Russ's community-based services, just because what we've found is that it really helps for somebody that we're serving to have a variety of supports that can kind of wrap around and meet all of their needs. So we might have a staff person who's focused just on housing, but then we might also have another staff person who's focused on things like employment or education, depending on what the participant that we're serving is most interested in getting help with. So, like I said, focusing on housing, and I will let Russ talk a little bit now about what the community-based services can offer to people.
Thanks, Eric. So, yeah, we have a variety of community-based services at Access CNY. Like Eric said, we served about 650 people in the last year. We have an employment department. So I think I'll talk a little bit about each service, and then just briefly show you how we've maintained service during COVID, and talk about some of the challenges as we go on, just as a framework. So we do have employment services, which can help people from everything from learning soft skills to resume writing to interview skills to then getting a job and maintaining a job. As you can imagine, as the general population, people with disabilities were affected by employment during the pandemic. We saw over 50% of our folks were laid off of work due to the pandemic. We're starting to see those numbers come back up as employers are rehiring, but we service a lot of the service industry, and as you may know, if you know anybody who works in the service industry, a lot of those jobs went away. So it's been a struggle, but we have continued to work with people throughout the pandemic to try that have maintained their employment and try to help people get hooked up with employment opportunities now that we're thankfully seem to be turning a corner and coming out of some of the lockdowns, and people are able to get back to work. As Eric did say, we have a supported education program, which can help people with a mental health diagnosis with everything, any sort of educational opportunity. A lot of times we go right towards college, but it's really anything. I always like to say it could be like a pottery class in adult learning, all the way up to we've helped people get their doctorate at Georgetown. So that's really the gamut. And so it's not support education is not really about tutoring and helping people with getting those kind of educational support. It's about getting people connected to all of those supports. So, how to navigate the school system, how to get all of, your money through FAFSA and all that stuff, how to maybe find the support that you need on campus because you might need some extra support. So, we can help you navigate those systems, how to find tutors, stuff like that. So it's really helping people get connected back into a path an educational path, whatever that path might be for anybody. Then we do have community support services, which is kind of just what it sounds. It's helping people get connected to their community, help them develop friendships through the community, how to stay connected, which has been extremely important during this time, trying to find ways to keep people connected in the middle of a global pandemic and is challenging, but our staff did a fantastic job of really pivoting to doing a lot of remote stuff, just like this, Zoom, and became a whole new thing for everybody to learn. Same thing with sport education. We had to teach, to go back, we had to teach all the students how to use this for classes, just like you would any other resource. But so for community sports services, where we do things like yoga and book clubs and men's and women's groups, we had to pivot to doing those online to keep people connected. We all know how isolating the last year could have been for folks. So trying to get people connected in any way that we could was really our goal. So it's helping people with all activities in the community. As we open back up, we'll get back into doing coffee hours in the community and helping people find recreational activities that they will help them with their health and wellness in the community. That's the overall goal. Like I said, we've had to pivot towards more Zoom, but we'll get back to being more in person, which is really what the program's designed for, to help people in the community. We have 2 peer support programs, which are staffed by people who identify as having a mental health diagnosis. And these programs are, I think, just immensely powerful and have a great impact on the community. One is Unique Perspectives, which is a recovery drop-in center, which is located downtown, right across from the bus station, which promotes self-help and just really trying to figure out ways to experience your strengths, get supports around anything that you need to try to keep your mental health where at a great place. We have a variety of peer-led activities there. Like I said, women's group, men's group. We have a Hearing Voices group that we're trying to get started back up again. Computer classes, arts and crafts, all kinds of things just to try to help people stay connected. The one thing that I am really proud of the staff there is that Unique Perspectives was the only drop-in center in Onondaga County for people with mental health diagnosis that I know of that stayed open throughout the pandemic. We did move to some more Zoom classes, but our doors never shut, which, Paul and myself and Eric, and we all were in lots of conversations about that. And, as long as we could keep the staff safe, we felt it important during a really scary time to keep the doors open to a community place where people found safety and that they could really connect. So I'm really proud that the staff were able to stay open during that time. It's a real credit to them and their dedication to the people that they serve, that even in the height of all this, that they stayed open. The other peer service that we have is the Brcana Crisis Respite Program, which is in Eastwood. And it's a place to go just if you need a break. It's an alternative to going to the hospital or going to CPEP if you just need a break from your current living environment. You need a supportive ear. You can come and stay with us up to 7 days. All you have to do is call and self-refer. Just you call Brcana and say that you're having a difficult time and you'd like a little break. Right now, we are at a 4-person capacity. We should be moving up to 5 soon. We kind of scaled down once again because of the pandemic. We're back up. We can go as high as 6. Right now, we're maxing at 4. Once again, just trying to keep everybody safe. But that is a really unique program that just helps people connect to each other. You know, you can work on real life goals. But we can also just help you connect to counselors or help you find access to things that you might need in the community, or just be a supportive ear to listen to. Like I said, being that it's peer run, you have somebody there who knows what it's like, what you're going through. They may not have walked the exact same path as you, but they've walked a similar path, and can maybe give you some positive encouragement along the way. So one of the things that is really cool about that program is we have a couple people working there now that actually started in Eric's residential programs, made it all the way through our programs, and now one is an assistant manager there, and one is a staff there. So they've gone from needing the most service that Access CNY can give you, all the way to now being employed by Access CNY. So that's very cool. And once again, that just proves to people that are in that, that there is an end path that you can get to through going through these programs. Another program that we offer is a Family Support and Education Center. That's run by Sheila Legacy. And that has a couple of components. One is an actual 10-week class for families of people who have a family member who has experienced a mental health diagnosis. And it's really about learning about the nuts and bolts of the mental health system, about mental health, about medications. It's really about, built off really knowledge is power. Really as a family member, the more knowledge you have, the more valuable you are to your loved one, and helping them navigate, which can be a cumbersome system. And so that is offered as a 10-week class. We do it 3 to 4 times a year. We've already done 3 this year, so we'll be doing a 4th. And then Sheila is also available just to consult with families that are in crisis. She's a family member herself. So, she will do everything from helping you navigate the hospital system to, helping you manage a crisis with your loved one in the moment. Sheila's really great about connecting with families. So that's our Family Support Center. And then the last one, I'm going to get back to Erica. I have lots of programs, sorry. The last one is Bridge Services, which is kind of works a lot with Eric's programs. And that is a program that is just for people who live in our residential placements. That it's just what it sounds. It's a bridge to the next step. So it's, you might not need Eric's intensive apartment setting anymore, but you still need somebody maybe to check in on you, to help you make sure that you stay successful in the community. And that's where a bridge worker can just do a pop in to maybe take you to the store, make sure that you're keeping your meds on track, just being an ear to listen to how your week's been. So that's a really successful service that we can serve. We've served people there who are now on the phone list, who we just get monthly. We've served people there for over 20 years, where it's really just keeping them successful in the community. And part of that might be just having a staff member that they know that they can reach out to if they need something. And it might be just once or twice a year, but that stability really helps people stay successful in the community. So those are the 7 mental health programs that I oversee. The 8th program I oversee, Paul already mentioned, which is CASA, so I won't go into that, but those are the 7 mental health programs that I oversee. So I'll throw it back to Eric so we can talk a little bit about residential, and then we'll take questions.
I think
I
you
gave
might,
you a lot.
yeah, you got a lot of things going on all at once for us.
Yeah, sorry.
Which, no, that's good, because it also kind of points to the challenge that the pandemic brought to our teams, because we offer such a wide variety of services. How was it that we could keep these services going as our community was on lockdown? What were our expectations of our staff? How can we make sure that the people that we are helping, who are, they're disabled individuals living in the community who need oftentimes daily support to do, everything going on in their lives. So when the pandemic first hit, our programs were closed to visitors. Like Russ says, Unique Perspectives, the drop-in center, did remain open, but our housing residential programs, they were closed to anybody who didn't work or live at that site. Our staff, essential staff, healthcare workers, they continue to report to work every single day to provide 24-hour care to people who are living in our residential sites. They were still doing their jobs as best as they could, but the jobs themselves were very different, because not only were our programs closed to visitors, but programs with other services, other agencies were closed to visitors. So when we're talking about people living in our group homes who were unable to go see their psychiatrist or go see their therapist in person, where was that kind of psychiatric support going to come from? So our teams did everything that we could to try and help people to meet that need. We, like Russ was talking about, we taught people how to engage in telehealth, how to schedule appointments using things like Zoom or other services. Access CNY was able to secure grant funding to bring in a specific telehealth tool. There's a company called Station MD, and so we actually are able to use that program to link up with doctors, both through psychiatrists and through medical doctors, to help people get care while they're also still locked down in their homes. Our teams tried to do our best just to keep people busy on a day-to-day basis. A lot of times people who are living in our programs, they're used to going somewhere during the day. They might go to a place like Unique Perspectives. They might go to another drop-in center, another club where they would get some social activity, things like that. So while people were kind of stuck at home, it was on us to try and come up with more creative ways to help people to stay active during the day. We would even do things as simple as movie nights, game nights, that maybe we weren't doing as frequently before. Activities just to try and get people, keep their spirits up, keep them active, keep them busy. Landlords, another thing. So we don't own all of our properties, we rent many of them. And so we have 63 apartments spread throughout Onondaga County. And all of our landlords were not entering properties anymore to do maintenance work unless it was like an emergency situation. So if we're having little things that are kind of falling apart in apartments, then it was on our teams to try and make things work in those apartments and keep them up to the standard that both we and New York State expect for the people that we're serving. Many of our staff started to work remotely if they were able to. Access CNY was able to provide all of our direct care staff who could work remotely with laptops in order to engage both with our participants through telehealth services and to take care of all their day-to-day work. So we had a lot of people who stopped reporting to offices and other locations if they were able to work from home. Same thing that a lot of other companies across the country were doing in order to adapt to the pandemic. As far as my role, it changed. I mean, my background right here, I'm working from home today. And this is how I was doing most of my work during the pandemic to to oversee 7 different housing programs serving 180 people in the community. So it's a challenge to try to stay in contact and stay in touch and understand really what all of our teams are going through, because while I'm working from home on a laptop, we also have 40 direct care staff who are reporting to work every single day. Some of those days came with extra danger. Our residential team had multiple COVID-19 outbreaks among the participants that were living at our group homes. We had participants who had to quarantine inside their bedrooms for 2 weeks at a time, with our staff, cooking and delivering meals to their bedroom door, bringing medications to them twice daily to make sure that they were getting all those basic needs met. But we're also asking our staff, essential workers, to report to these sites where we know people are living there with COVID-19. And to the credit of all of our teams, our staff continued to work. We didn't see things like our staff quitting, walking off the job, or people giving up their responsibilities. Our staff continued to come to work every single day to provide support to people who need it. And that's one of the main things that I took away from this pandemic, was the dedication that our teams have shown when they were needed most by the people who were most vulnerable. We did have some staff who were quarantined or were diagnosed with COVID-19, but it wasn't too significant for us. Access CNY implemented, safety measures across the board, making sure that we had PPE in place, making sure that we had sanitation practices at all of our sites. And I think it was actually quite successful, considering the number of people that we serve in close quarters. And we really did have minimal numbers of outbreaks with, it was probably fewer than a dozen program participants in our mental health residential services. And I believe it was maybe 4 or 5 program staff who were actually diagnosed with it. And we believe that they also contracted COVID-19 in the community and not while they were at work. So we did a great job, I think, as an agency of ensuring the safety of everybody involved with our programs. In addition, I'm sure that people have been noticing in the news that New York State also put a hold on all eviction proceedings during the course of the pandemic. And that did affect some of our housing programs, but really what it meant was that we just wanted to maintain closer communication with landlords to ensure that any problems that could potentially come up in an apartment were being addressed very quickly before a landlord would be attempted to pursue evictions for the people that we serve. So I think that's the adjustments that we had to make, was just trying to move people remote whenever we could, trying to keep people occupied as best as we can. And now, as we're kind of coming through this, we're starting to see other programs and services open up, and we are getting our program participants back out in the community. We're seeing more referrals come into our program. That's one way that our mental health services across the board kind of saw a decline in referrals. So we didn't have any new people coming in that we could help, but I do believe that that is picking up again. So hopefully, as we move into 2021, we'll be able to serve even more people in our housing and community-based services.
This might be a good time for me to jump in and just talk about what Access CNY is doing now to prepare for the post-pandemic future, if you will, and that we certainly recognize that we really don't know the full extent of the impact COVID will have on our community's mental health. There's certainly, as Eric pointed out early on, there has been no doubt an increase in mental health diagnoses and anxiety and stress and depression within the community. And we expect that to go on for some time. And so we want to make sure that as a not-for-profit agency that we are adapting to meet those needs of the community. And so a couple of programs that we are focusing on growing include our children's home and community-based services, which help children that may have a developmental disability, but also likely have a mental health diagnosis, to get the support that they need, right? To avoid hospitalization, to avoid a long-term stay in a facility. That particular program offers an array of services, including planned respite, community support, just support for families and caregivers, as well as self-advocacy training for people. And so it's sort of a package of services that help children especially cope with mental health diagnoses. And again, that's more of an issue now than ever before. Another area that we're focusing on that's really been a long-standing need within our community is the need for improved primary care support for people with mental health diagnosis or a developmental disability. We're happy to announce just recently that we have a new medical director, Dr. Dosa, Nika Dosa from Upstate Medical, who's one of her primary roles at Upstate is to chair their spina bifida clinic, but she also has a career-long experience with supporting people with disabilities. And so we're looking forward to other ways we can partner with her and with Upstate to improve the primary care for people with disabilities, especially as they transition from childhood to adulthood. That's really a time where I think we have wonderful resources for children with disabilities in primary care in our community, but where a lot of times the support isn't there as we'd like to see it is when they transition to adulthood. There's fewer resources, fewer medical doctors who support people who are adults that have a disability. And so we're hoping to improve that. And one program that I should mention, it's not a new one, but I think it's important for the community to be aware of is we have is our trade program, which is an adaptive device lending library. So we have a warehouse full of adaptive equipment, everything from wheelchairs to grab bars to shower chairs that is free and available to the public for short-term loans at no cost. And so whenever anyone needs, on a short-term basis needs that type of equipment, that's there for people to use. All we ask is that when you're done with it, you return it. So if someone has an unfortunate accident and needs those types of devices, crutches, wheelchairs, you name it, we're there and we can support them until they can find a permanent use, a permanent resource for those for that need, or hopefully just until they recover and don't need that equipment anymore. And that information, as well as more information on all of our programs, is available on our website, accesscny.org.